Hi everyone, it's Courtney again. I am back this week to talk about some important things to keep in mind amidst the COVID-19 pandemic. This week, I just want to give a brief update on how access services have changed and how we as an agency are making sure that our clients and our staff are as safe as possible. First, I just want to take a moment to remind everyone that even though we are staying home and socially distancing, the need for crime victim services hasn't disappeared. While making decisions on how to respond to COVID-19, ensuring that survivors have access to these needed services has been at the forefront of all decision making. There are just a few key changes that I want to touch on today. The first is that staffing at our physical offices is limited, so to initiate services, go ahead and call our helplines, which I will list in a few moments. Also, just keep in mind that if you call our business line, you may be directed to voicemail. That's fine, just leave a voicemail because that is being checked regularly. Staff has been really creative in finding ways to serve clients remotely, knowing that remote advocacy right now is what's safest for both clients and staff. This includes telehealth-style video appointments, phone-based services, electronically signing confidentiality agreements, and hosting support groups and events on online platforms. When in-person services are performed, Access is taking every precaution to keep all those involved safe. So this includes being in open air, allowing for 6 feet of distance between everyone participating, trying to take no longer than 10 minutes, and encouraging all people involved to wear a mask. To help ensure that survivors have access to emergency housing, we've made a couple changes to ensure everyone's safety. This includes limiting the amount of clients in each room to avoid having multiple people share spaces and cleaning more thoroughly. For clients that are seeking permanent housing as a result of fleeing violence, we are still offering financial assistance as always. This process has just been moved to online, so go ahead and call our housing line to start that process. As public health guidelines change, Access will continue to adapt. Access is also monitoring what community partners are doing in regards to openness, but keeping in mind that our services are just different than some of those. Although services may look different, we just want to remind the community that our top priority is ensuring survivors have access to essential services and a safe, empowering space. Access will continue to adapt to guidelines with clients and staff's well-being at the forefront of decision-making. As always, our services are free and confidential, and I'll go ahead and list the 24/7 helplines now. The Domestic Abuse and Homicide Violent Crimes line is 515-292-0519. The Sexual Abuse line is 515-292-5378, and the Housing line is 515-292-0593. Thanks all for listening, and I hope you have a great rest of your week.